All right, welcome back in. Time for our Ask the Doctor segment now, and we are talking about things like acid reflux or any gastrointestinal problem that you may have. Dr. Raj Parikh is from Brookwood Hospital, and he is here. Hello, Dr. Parikh.
Thanks for having me again. Good to see you.
I just want to tell our viewers that you've only been here, what, about 9 months?
Correct.
From New York. So born and raised in New York and now here in the South, and so welcome.
Thank you very much. Loving it so far.
Good, good, good. All right, our first caller, I'm sorry, Sandy, I forgot what you said. Patricia is on the line. Hey, Patricia.
Hey.
What's your question?
My question is, what's the difference between acid reflux and indigestion?
All right, that's a good question. A lot of GI disease, the terms get mixed up. Acid reflux is really referring to when you get that really burning sensation in your chest, almost like the contents of your stomach are actually refluxing into your chest. And there's a lot of acid from your stomach secretions, and that's what we're referring to in acid reflux. Indigestion is more of a vague term where it can mean stomach ache, it can mean acid reflux, it can mean a lot of anything. So indigestion is just something's bothering you, and we kind of ask you more questions to get to the bottom of it.
Does that answer your question, Patricia? Okay, hopefully that answered the question. Lynn is in Moody. Hey, Lynn.
Hi.
What's your question?
My daughter just had gastric bypass surgery last week, and she never had acid reflux problems before, but the doctor gave her a prescription for Prilosec. So I'm wondering, does this mean that it's going to be common to have acid reflux?
Yeah, that's an excellent question. Gastric bypass is becoming much more common these days, and it has lots of great benefits. But unfortunately, the stomach pouch, which is what's created after the surgery, is very small, and maybe more so at the beginning in the post-op recovery period, you get a lot of reflux, and it can be quite a nuisance for many patients. So sometimes we kind of prevent it from coming on by treating early on. And then we may wean off the medication later on if we see that they're tolerating.
Is there anything that she needs to be doing any differently that would help with that?
Yeah, absolutely. And she's got a little bit of a special case. She just had a major gastric surgery. And like I said, she has a very small gastric pouch now. That's the whole part of the concept behind gastric bypass. So she's going to want to take smaller meals. There's certain foods to kind of avoid which will increase reflux. Certain things include caffeinated products, coffees, teas, chocolates. Many people don't realize there's a good amount of caffeine in chocolate. Tomato products, tomato sauces have a lot of acid, citrus products, and the one thing that people don't realize is minty candies and teas and gums actually helps relax your lower sphincter of your esophagus, which is kind of the food pipe that leads to your stomach. And people get more reflux when they take minty products.
Okay.
Yeah.
All right, well, good luck with her. I'm sure she'll be great with the surgery.
Good luck.
Let's go to Kelly now. Kelly is on the phone. Hey, Kelly.
Hello, how are you today?
Good. What's your question?
Yes, I have reflux really bad, and I was wanting to know if you have it real bad like I do, will it cause you to have diarrhea?
Reflux should not cause diarrhea. Some of the medications you take for reflux can cause diarrhea. There's different types of medications. They can buy over-the-counter or prescription, depending on how severe your reflux is, and some of those could cause diarrhea. But I would not assume that to be. I would have that evaluated by your gastroenterologist or your physician. Make sure your diarrhea is not from something else. Okay.
All right, let's go to Jan. She is in Leeds now. Hey, Jan.
Hi, how are you?
Good. What's your question?
I have a question that I think it's an unusual problem that water causes gastric reflux with me.
Oh, that's interesting. Is it any liquid or just water?
No, it's actually just water. I would drink a lot of water when they came out and said that we needed more water to hydrate, and I have a horrible time with indigestion.
That is interesting. I've heard that with liquids, not water specifically.
But it doesn't do it with other liquids?
No, I don't have a problem.
Okay.
No, I don't have a problem. Now, if I drink a lot of Cokes, yes, it will. But
and that's the caffeine right there.
Yeah.
Well, sometimes the thing I worry about with liquids, when that causes a lot of reflux, I wonder if you might have what's called a hiatal hernia, especially if you're drinking a lot of fluids. A hiatal hernia is when your stomach kind of comes up into your chest when it shouldn't be. And if you're drinking a lot of fluids at once, that can cause a little bit of reflux of stomach contents.
Would that be a simple test if she told her physician,
yeah,
this is what I'm doing, something they could
there,
check?
There are a couple of ways you can check that. One way is what's called a barium swallow, where you drink some fluid and we kind of see what it does as it trickles down using an x-ray. Another thing we do at Brookwood is what's called upper endoscopy, and we can take a look at the anatomy of your esophagus, your stomach, and see all the connections and see if there's anything that may be leading you to having these problems.
All right. Dr. Parikh, thank you so much.
Absolutely.
All right, great calls today, great answers.